I'm a consulting urologist from Nasik. I've been practicing here since last 7 to 8 years. I've performed many endoscopic, laparoscopic, and open cases. We will be discussing shortly regarding interstitial cystitis, which is quite a debilitating disease, very much more prevalent in females. The disease is often known to cause severe hampering of lifestyle, and many patients are suffering agonizingly through the disease. So we will shortly discuss about interstitial cystitis here. Interstitial cystitis is also called as bladder pain syndrome. Actually, it is a disease entity which consists of a combination of symptoms. These symptoms would include a feeling of lower abdominal pain or pressure upon bladder distension. That is, whenever the bladder is full, that time the patient would experience a kind of a pain or a pressure which will compel him to go for urination again and again. That would increase her urinary frequency, and this frequency would disturb her sleep in the night hours also. This patient would often need to go every half an hourly, or in certain cases, which are very severe, they would have to rush towards the bathroom every 15 to 20 minutes also. And this is also going to generate a kind of urgency. In this particular scenario, the urgency is because of pain that the patient would experience whenever her or his bladder is full. But it is usually not because of fear of leak, which otherwise would happen in cases of overactivity. This condition is very chronic actually, because there is no particular or pinpoint treatment towards it. So the patient would often experience fluctuation in their symptoms. That there would be waxing and waning of symptoms. At times the patients are very much normal, and there would be phases when the patient would experience a sudden increase in their frequency of urination, and just the pain quotient. The condition is often diagnosed by doing cystoscopy. Cystoscopy is endoscopic evaluation of the bladder, wherein we would put in a scope inside the bladder and would try to observe certain characteristics which would help us diagnose whether the patient is having interstitial cystitis or not. This would include appearance of certain ulcerations or certain patterns of glomerulations or pateches. So this will help and confirm the diagnosis of interstitial cystitis in such patients. The disease entity is quite common. It is almost 6 times commoner in females compared to males. Almost 1 in every 5,000 to 10,000 females are known to suffer through it, either in the mild or a very severe form. The disease spectrum could vary, but the disease is quite common. It is every 1 in 5,000 people are known to suffer through it. And there are various theories which are put forwards, like absence of gag layer, histamine release, neural hypersensitivity, autoimmune pathways. But what is more important here is to understand that in this patient, there is loss of a mucous layer, which is called a gag layer, which actually is a protective layer. This layer covers the bladder from inside, and it would prevent the contact of urine with the bladder mucosa, that is the bladder scheme. So thereby it would prevent the contact of contaminants or irritants which are normally present inside the urine with the bladder mucosa, and thereby it would prevent the irritation. In the patients with interstitial cystitis, the absence of this layer would cause the direct contact of bladder contaminants with inflamed inner lining of the bladder, and this would cause pain upon bladder distension, and hence this patient would have to go for frequency would have urinary frequency very fast. I mean, they would have to go to the urination very fast because they would sense their bladder very earlier. And going ahead with do's and don'ts, the do's would include limiting a fluid intake to a certain moderate limit. They don't have to limit the fluid intake to a very low quantity, which would actually concentrate the urine and would further aggravate the symptoms. Nor they are supposed to increase their fluid intake so as to cause very increased frequency of the urination. The ideal fluid intake would be around 2 liters to 2.5 liters of water a day. So maintaining that particular quantity of fluid intake would actually limit the frequency to to its minimum possible level. Then there are certain exercises that the patient can do. This would include moderate level of aerobic exercises, meditations, yogas, then keeping a positive attitude and accepting the problem. Acceptance goes a long way in actually facing the condition, because if the patient is kind of in the denial mode, the suffering is going to further increase. Then there are certain lifestyle modifications, like patients should have bathroom inbuilt inside their bedrooms, or they should have a toilet at their working place very close to them, and they should always study the place which they are traveling to. They should find out where exactly the toilet is located, so that whenever they feel an urge, they could have an access to the toilets early as possible. And don'ts would include avoiding spicy foods, beverages like coffee, drinks like soft drinks, and alcohol, because this would increase the frequency to a very high level and would cause a great amount of bother to the patient. Then avoiding emotional stress can go a long way in managing the condition. Then those don'ts would also include stopping medication on their own whims, because this medication would act over a long run. Patient would not understand the importance of continuing the medication for a very longer period of time. Usually, the patients are not going to feel the relief within a very short span of time after starting of the medications, because these medications are known to act over a very longer period of time. They would replace the gag layer which is inside the bladder, which has been deficient, over a period of months together. So stopping the medication is going to increase the symptomatology with the patients. So stopping the medication is a strict no. The importance of treatment adherence cannot be overemphasized here. Being a chronic health condition, it's a chronic treatment, of course, with the patients and a complete adherence towards it. Although the condition cannot be cured, it can be managed very effectively, and often the medications and lifestyle changes needs to be continued for months together, in certain cases for the entire life. The condition is known to wax and wane, so there are frequent relapses. The patient has to understand this, and every each waxing phase, the patient would have to increase the medications, or would have to be get treated very aggressively. Regarding diet, actually, there are certain fruits which are very friendly, and there are certain fruits which would increase the patient's symptom. Bananas, apples, pears, and cucumbers are known to reduce the symptoms, would reduce the frequency of the urination. As against that, the citrus class of fruits like lemon, limes, oranges, kiwis, and grapes would make the urine more acidic, would make it more irritant, and the patient would experience more amount of frequency. Then there is the role of yogurt. Yogurt, in certain cases, in certain patients, it would reduce the frequency. As against that, in certain patients, it is going to increase. So that would have to be find out by the patient himself or herself whether the yogurt is helping them or not. Then there are milk products like cheese, butter, milk itself. These are known to increase the pH of the urine and would make it less acidic, and hence would reduce the frequency. The role of exercise cannot be again overemphasized. Kegel's exercises, which are normally advocated in overactivity of the bladder, that is, in those patients who are like not able to control their urge, would leak before they reach the toilet. The Kegels would help such patients. But here in this particular scenario, Kegels are contraindicated. They would rather increase the pain and would increase the difficulty in passing urine. Here, on the contrary, this patient would require pelvic floor relaxation techniques. Uh, there's a method how to go about it. In this particular technique, the patients are asked to spread their legs 30 to 40 degrees of angle, and then they are asked to identify their vaginal, urethral, or anal muscles, and they would ask to relax them, and then they are asked to feel the relaxation spreading to their pelvic musculatures and going towards the leg. They are supposed to repeat these sets around 22 to 30 times per set for 2 to 3 times a day. So this can help relax the pelvic floor muscles, uh, would also calm their pressure points, and would help in a certain way. Then there are other stretching exercises which could stretch pelvic floor muscles and then would help them relax them. Again, having said this, moderate level of aerobic exercises like walking, running, hiking are known to produce the level of stress, and there are certain hormones which are also improved that would help improve the symptomatology of these patients. So these are what are advocated exercises in such patients.